Falls are common in adults aged 65 years and older. In the United States, about a third of older adults who live at home and about half of people living in nursing homes fall at least once a year. There are many factors that increase the risk of falling in older adults. These risk factors include mobility problems, balance disorders, chronic illnesses, and impaired vision. Many falls cause injury, ranging from mild bruising to broken bones, head injuries, and even death. In fact, falls are a leading cause of death in older adults. If you enter a room and discover a resident has fallen, do not move them unless they are in immediate danger of further injury. Notify the nurse as soon as you observe the situation so the resident can be assessed and treated. Typically, a mechanical lift will be used to raise the resident from the floor to prevent injury to themselves and staff. As a nursing assistant, there are several actions you can take to prevent falls. Keep the environment clean and free of clutter that can cause imbalance while a resident is ambulating. Walking. If a spill is noted on the floor, it should be cleaned up immediately. Whenever residents are standing or walking, be sure they are wearing non-skid footwear, i.e., shoes or socks with rubberized soles. Use ordered assistive devices such as gait belts and walkers when moving a resident. If a resident wears glasses or hearing aids, make sure they are functioning, clean, and properly fitted for the resident so the resident can safely assess their surroundings when moving. Additional information on fall risk and preventing falls can be found in a later module. You learned about agencies that govern healthcare, such as the Occupational Safety and Health Administration, OSHA. OSHA provides fire regulations and guidelines for every place of employment. This knowledge is essential for keeping residents safe in healthcare settings due to their limited mobility. Compliance to these regulations when responding to fires is commonly reviewed during the survey process. The response to a fire can be remembered by the ERACE and PASS acronyms. R. Rescue anyone in immediate danger from the fire if it doesn't endanger your life. Activate the alarm by pulling the nearest fire alarm or calling 911. C. Contain the fire by closing all doors and windows. A. Extinguish the fire if it is small enough using a fire extinguisher, and the PASS method. If the fire cannot be extinguished, then evacuate patients and oneself from the area. The PASS method includes the following actions. P. Pull the pin on the fire extinguisher. I. Aim the extinguisher nozzle at the base of the fire. S. Squeeze or press the handle. Sweep from side to side at the base of the flame until the fire appears to be out. Once you have finished reviewing this, please watch the UC San Diego Health's YouTube video on using RACE plus PASS training, which can be found in the following section. Choking is a common cause of unintentional injury and death. Over half of the people who die from choking are over the age of 70. Food is often responsible for choking incidents in the elderly, especially those who have difficulty swallowing or have dentures. Many people who have dementia or who have had a previous stroke have difficulty swallowing. If you see any signs of choking, immediately notify the nurse and take action to clear the person's airway. If you are in a setting without a nurse present, it is important for you to know what to do and how to rescue someone who is choking. If a person is continuing to cough forcefully, encourage continued coughing to clear the object. However, a person who can't cough, speak, or breathe needs immediate help. Ask the person if they are choking and let them know you will use abdominal thrusts, known as the Heimlich maneuver, to help them clear their airway and breathe. Keep in mind the Heimlich maneuver is not recommended for children younger than 1. To perform the Heimlich maneuver, perform the following steps. Stand behind the victim with one leg forward between the victim's legs. If the person is sitting in a wheelchair or not able to stand, lean them forward in the chair and stand behind them. For a child, move down to their level and keep your head to one side. Reach around the abdomen and locate the navel. Place the thumb side of your fist against the abdomen just above the navel. Grasp your fist with your other hand and thrust inward and upward into the victim's abdomen with quick jerks. For a responsive, pregnant victim, any victim you cannot get your arms around, or for anyone in whom abdominal thrusts are not effective, give chest thrusts while standing behind them. Avoid squeezing the ribs with your arms. Continue thrusts until the victim expels the object or becomes unresponsive. If the person becomes unconscious, perform standard cardiopulmonary resuscitation, CPR, with chest compressions and rescue breaths. After choking stops, seek medical attention for the client. Further information about the Heimlich maneuver, including a video, will be included in a later portion of this course.